Many as 40 cases of Delta Plus have been found in India. The government fears it has higher transmissibility. The experts are saying it's time for India to do a quicker tracking of the variants and mutations, and efforts need to begin to ramp up genome sequencing. But what really is genome sequencing? Because this really is the key to identifying and tracking the virus and the mutations as they spread. Sneha Mordani reports.
A network of 28 labs is undertaking genome sequencing of coronavirus in the country. Experts say India has never sequenced variants in a big way, but the second wave and now the emergence of the Delta Plus means we will have to pick up the pace.
Genomic sequencing has been restricted to research institutions in India. It was not in the DNA of our fabric to sequence clinical samples. Now the need has come, so we are tying up institutes to hospitals and bringing up the facility.
The surveillance allows researchers to examine the genome sequence of the viral strains infecting the population. Continuous monitoring of viral genome variations is very useful in tracing the path of the spread of the disease. This information can be used in deciding containment measures and strategies. Mutations can also influence the course of the pandemic by altering the properties of the virus and generating new variants. Mutations conferring immune escape are of particular concern. Currently, 45,000 samples have been genome sequenced in India by the Indian SARS-CoV-2 Genome Sequencing Consortia that was formed towards the end of 2020. However, given the country's population and case burden, sequencing numbers remain disproportionately low.
What we need is that 0.2 to 0.5% of this population will need to be screened. Now that calls for a more complex approach. We can mount a much faster public health response, which could be lockdowns, containments, tracings, and especially ICU surveillances, to look at which is that aggressive strain that is leading to the deaths in these people.
The government says that they are looking at ramping up genomic surveillance in a big way in the country. Collection of bioinformatics and data from rural India and also from places worst hit in the second wave of the pandemic is being done. They're also saying that they have expanded the network of their own labs, apart from looking at involving private labs in all of this. That conversation too, they say, has begun. With inputs from Nolan Pinto in Bengaluru, Sneha Mordani in Delhi for India Today.